Happy Thursday, everybody. Today's topic is what if your doctor doesn't support keto? Welcome back to the Daily Spoonful. I'm Dr. Rose Petrilla, and today's truth might be a little uncomfortable. What if your doctor doesn't support keto? Or for that matter, ketovore or carnivore? Let's talk about how to advocate for your health without starting a war. Many doctors still rely on outdated nutritious advice. They were taught that fat is bad, carbs are fuel, and keto is dangerous. And one of my doctors keeps telling me that red meat is inflammatory. But guess what? You're allowed to be curious and you're allowed to do your own research. And you're absolutely allowed to say, this approach is working for me, and I would love to continue with your support. And that's essentially what I had said with my family doctor. And I was sent to a specialist, a lipidologist, who really struggles with me, but we're trying to work together. If they dismiss you or refuse to monitor your progress, it's okay to find someone who will. You don't need permission to pursue better health. You just need the courage to ask questions. So for me, I have a very atherogenic um, marker, and it's LP little a. And you want that number. It doesn't really change throughout your lifetime. And you want that number to be under 50, and mine's 297, which puts me at high risk for atherosclerosis and cardiovascular disease. My father died at 52 from his fifth heart attack. And so I said, okay, I'll see a lipidologist. And when he heard that I was on the ketogenic diet, I thought he was going to expire right there. And so I've seen him several times, and he's very kind, and we're working it out. But I told him, I lost so much weight, and these were my numbers before, these are my numbers now. And still, he'll say to me, well, maybe once or twice a week, you can switch out eggs and bacon or sausage for oatmeal, until I finally leaned in and I said, I was 254 pounds and ate oatmeal every day for breakfast. And so, God love him. I know he's in pain when I'm in his office, but we really are working it out. He also told me to go back on the DASH diet. And same answer, 254 pounds. So I smiled and I thanked him, and he did send me for some testing. We are monitoring my carotids. That's where I do have a little plaque. But for right now, I am free of any kind of plaque or hard plaque, calcified plaque, or soft plaque in my coronary arteries. So he is providing the test for me, and he actually said to me, because of course he wants to put me on a statin, and he said, I ran with all my blood work being so good. Uh, he said, when I put you in the algorithm, if I give you have an 8% chance without any cholesterol medicine to have a cardiovascular event between now and the time you're 80. And he said, if I put you on a statin, that'll go down to 6%. So he agreed not that the statin was not worth it. So I tell you this story because if you go in prepared, you can really um, kind of come to an agreement. And I like to think that I'm teaching him something that he didn't think was possible. Okay, so for today's strategy, before your next appointment, write down what's working for you. How are you tracking your progress? What support you're hoping for? Remember, you're the CEO of your body, and the doctor is the consultant, not your boss. Your life, your labs, your long term health all deserve respect. And if that means having a brave conversation, you're more than ready. I'll see you tomorrow for Fact Friday.